Good morning, Peter Goertz. I'm a psychiatrist. Do I have what it takes to be a psychiatrist? You may be asking yourself that, and the short answer is more than likely you do if you're interested and motivated. So let that be reassuring to you. It's a very gratifying and interesting career, and it's definitely, in my opinion, worth investing all the time, energy, potentially money. However, there are potential challenges, and I'm going to talk about some of those now. Briefly, one differentiating issue, you may, if you're thinking about a career in psychiatry, you may also want to consider a career in psychology or social work. It depends what you like. There is overlap between the three of those careers, but there are also some differences, and everyone has their preferences. So a psychiatrist is a medical doctor who is specialized in the area of psychiatry, can prescribe medications, is educated in the basics of internal medicine, etc. A psychologist is not a medical doctor, and in general, psychologists do not prescribe unless they have additional education, and only certain states in the US allow that to happen. And a social worker is someone with a social work degree. They often do psychotherapy. They cannot prescribe medications, and it's a different path. But again, for different people, different paths are interesting. So as a psychiatrist, if you want to be a psychiatrist, you have to have a medical degree, and that means a lot of time with books, a lot of memorizing. So you have to be willing to invest that time and energy. And again, it's worth it, in my opinion. After medical school, you have to do a psychiatric residency, and you're getting paid already. Not a huge amount, but you're getting paid. And at the same time, you're getting educated. You're supervised, you have teachers. So that is actually a very good time, and you want to choose a residency that works for you, where you get exposure in things that you're particularly interested in, and in general, a wide exposure. So in psychiatry, you're going to be exposed to a lot of people, period. A lot of patients, a lot of coworkers, and everyone is going to come from different backgrounds, different races, different financial backgrounds. You're going to have exposure to females, males, transgender people, homosexuals, heterosexuals, bisexuals, people of all kinds of political views, right, left, and you're going to have to deal with all those people. So that is something to consider. You're going to be exposed to literally all kinds of people, and you're going to have some patience, tolerance, open-mindedness in order to deal with these people. And when I say deal with, that is not a chore. It's a privilege to actually interact and deal with all these people. You're going to have patients in emotional turmoil, suicidal patients, homicidal patients, psychotic patients, depressed patients, anxious patients. So again, you need to be able to tolerate that intense emotion, whatever it is, high anxiety, suicidality, and you don't want to have to feel like everything needs to be fixed in a minute. These are often very chronic issues, so you have to be patient and have that ability to and willingness to accept these people in their very intense emotional states. One very difficult issue, maybe I can talk about more in a different video, is dealing with a patient who commits suicide. So dealing with the aftermath of a patient who has committed suicide, that can be difficult for any doctor. So that is something definitely that if you're a psychiatrist long enough, more than likely it's going to happen. And it does not mean it's your fault. But of course, any doctor is going to ask themselves questions about that. You're going to deal with patients who potentially assault staff. That is not uncommon. You're going to deal with patients who assault each other. Also not uncommon, especially on inpatient psychiatric wards. You're going to see patients who physically neglect themselves. I'm just remembering one patient who had not that old actually, a patient with huge open sores on her legs, maggots in those sores. So you're going to not always be seeing the most beautiful things. And in general, that's the case in medicine in general. So you have to be willing to be a doctor and be willing to be exposed to things that are not necessarily the nicest things to look at. You're going to deal with patients cursing at you, not infrequently on inpatient wards, patients making sexist, racist comments about you. And then on the other hand, you're going to probably have patients who ask you out. So you're going to have a whole variety of patients, and you're going to be put in situations that, especially the first time, are not that comfortable. But again, the challenges can be also enjoyable. Again, you're going to be meeting all kinds of different people. You're going to be dealing with, like I alluded to, you're going to be dealing with some issues that are not necessarily fixable in a minute. You're going to be dealing with very chronic issues to an extent, schizophrenia, chronic depression. And you want to be able to tolerate that and, again, not feel like this has to be cured or solved in a minute. And in that context, a lot of the patients you're going to be seeing will not take their medicines. I remember when I was an intern in the surgical emergency room, one of the attending doctors there told me they did a study on, they emptied the wastebaskets, I don't know for how long, the trash cans outside the emergency room, the surgical emergency room, for, I don't know, maybe a couple of weeks, and did a study on how many prescriptions were thrown in the trash can of the patients who walked out of the emergency room with a prescription. So you're going to have to be able to accept that a lot of patients do not cooperate with treatment, they do not take their medicines, they do not come to visits. So try not to take it personally, and that is something that is part of the, especially with psychiatric patients, part of the general field. You're going to be working with nurses, social workers, activity therapists, music therapists, lawyers for the patients, for instance, lawyers for the hospital if you work in a hospital, administrators. And that can be a lot of fun. You're going to be working with all kinds of various disciplines, which is a lot of fun. Now, the other side of that coin is you're going to be dealing with the personalities of all those people. And one thing that's crossing my mind now is I remember one of my superiors, one of my bosses once years ago asked me to do something with a patient that I thought was unethical. And I didn't do it. However, other people where I work did it, and I really feel bad about not intervening and stopping them from doing it. So you're going to be put in positions where you're going to be potentially at least asked to do things that you feel are unethical or medically not appropriate or in some way not acceptable in your opinion. So ultimately, you're going to have to look yourself in the mirror. So ultimately, in my opinion, it's probably better to lose your job, or it is better, in my opinion, to lose your job than to do something that really does not feel right to you. You're going to be dealing with bureaucracy, insurances, disability forms. My advice with that is keep that to a minimum. If at all possible, delegate that bureaucratic work to others. Like in our clinic, nurses do a lot of that. The office staff does a lot of that. So try and minimize your time with paperwork. Try and minimize your time writing notes if possible so you can spend time with patients, focus on patients. And I mentioned disability forms. One difficult issue, and that was actually an interesting issue at the VA, and not just at the VA, but at the VA, a lot of the patients wanted benefits, and if they were not sick enough, then they wouldn't get the benefits. And if they did not remain sick, then they wouldn't continue to get the benefits. So our system is difficult in the sense that it encourages people to remain sick if they want their benefits. So it's a very difficult system to navigate for the doctors also. And another issue is in our system, it's at least to an extent about money as far as the hospitals. They need to look at the bottom line. So your visits are not always as long as you'd like them to be, sometimes only 10 or 15 minutes. And in our clinic, we're lucky actually. We generally get half an hour allotted for visits, but often the patients are late. So you're going to end up having visits that are pretty short where you do want to get some work done. So anywhere between ballpark, usually anywhere between 15 and 45 minutes, unless the patient's late. And in general, or often people do not get 45-minute visits. In our clinic, I'm fortunate enough that if there is time in the schedule, patients are allowed to schedule visits for 45 minutes. And that way it's a lot of fun because you can do some of the psychotherapy also, not just medication management. And even in the shorter visits, you can do some psychotherapy, which is fun for me. Nowadays, there are a lot of virtual visits, so you're going to have to deal with technology not functioning, which can be quite annoying to the patients and the staff. You're going to be talking with a patient, all of a sudden the system stops working, you can't hear what they're saying, it may be something kind of pressing, hopefully nothing urgent. So times are changing. The virtual visits in general are good, but they have their difficulties, for instance, the technical difficulties that can be challenging. Thank you. Bye.